topic is about an overview of the relationship between ovarian hyperstimulation syndrome and hypertension. Can you move my slides? Excuse me?
Yes.
You know? Yes. Okay. This is a narrative review, and first of all, I want to tell you that what is OHSS. But before that, we have to, explain for you some terms like infertility. Infertility is some of the most, global problems around in the world. Increasingly, their numbers recently in the 21st century. And because of some factors, the multi-factors like environmental factors, genetic factors, unhealthy lifestyles, obesity, smoking, and medical conditions. And all of them cause some couples to have inability to get conceived after 1 year or longer through a natural process. So the physicians start treating them by some ways like ARTs. And ART is the abbreviation for assisted reproductive technologies. And it has some types like IVF, ICSI, IUI, etc. But one of the most predominant type is IVF. Sorry, can you get access for me to run the slides? Because there are a lot of slides on there.
I cannot able to give it to you because if you can able to share, then you can present. Because I'm presenting,
Yes.
so definitely I can only change.
Oh my God. Okay. Never mind. Okay. I give my speech anyway. So the ARTs is one of the most way that are able to treat infertility around the world. This is really beneficial, but one of the most predominant type of ART is beneficial for couples is IVF. IVF is the abbreviation for in vitro fertilization. It means fertilizing in the laboratory in vitro. It possesses 4 steps. The first step is administering high-dose gonadotropins to have a controlled ovarian stimulation. And after reaching the standard levels of numbers and size of ovocytes, they retrieve ovocytes in the surgery rooms and then put the ovocytes in vitro by sperm prepared in vitro and inseminate them to get access to the embryo. And after that, they transfer the embryo. All of them is called IVF. It's a really beneficial way, but sometimes iatrogenically can cause some lethally and dangerous complications for patients. That names OHSS. OHSS is the abbreviation for ovarian hyperstimulation syndrome. It is one of the important iatrogenic conditions during IVF procedures. And according to classifications for time and manifestations, because these are 2 kinds of classifications of OHSS, but the time is not really important. It's early and late, but we just want to focus on the manifestations. This is really important. Before coming to presentation to reach the hypertension as one of the important presentation in severe OHSS, I'm gonna explain for you and show you the most important risk factors for OHSS. These are really important because by knowing them, we are aware and we know that which patient is more at risk of OHSS in IVF procedure or not. One of the important most risk factor is PCOS. Another is antral follicle count more than 8, age less than 30, low BMI, also small ovarian follicle count more than 14, also serum estradiol levels more than 2,500 picograms per milliliter during ovarian stimulation, etc. But what are OHSS clinical presentations? We have 4 grades for OHSS according to clinical presentations because they are real diverse and different from each other. For mild, actually they're mostly asymptomatic, but some of them may have some mild symptoms like mild ovarian enlargement, mild nausea, vomiting, etc. But in moderate form, they have plus of mild symptoms. They have plus sonographic ascites. And also some laboratory changes gonna show themselves, like hematocrit increases more than 41%, white basic counts increases more than 15,000 per milliliter, and sometimes they may have proteinemia. When we go to the severe and critical stages of OHSS, the hemodynamic changes appear, especially from the simple hypertension to different kinds of shocks. In the severe form, hypertension is appeared, and along with some other clinical signs, some more severe laboratory changes, and also oliguria, etc. In the critical form, we have more serious and more dangerous and critical signs of hemodynamic change like shock. All of them really necessary to know about them to be able to manage the patients, because the OHSS maybe it's not relevant to the cardiovascular, but because of the co-related symptoms like hemodynamic changes and the effect to cardiovascular system is necessary thing to understand it and be able to manage the patients and distinguish the differential diagnosis of them. So about the hemodynamic changes, overall, we don't have any standard, accepted standard level of hypertensive level to define, but all in all, we can define hypertension as a low blood pressure. Blood pressure less than 90 or 60 millimeters of mercury. But for some, but there is some, special words for hypertension. I mean, like absolute hypertension, that means systolic blood pressure less than 90 or diastolic blood pressure less than, systolic blood pressure less than 90 or diastolic blood pressure less than 60 millimeters of mercury. Or orthostatic hypertension, that means systolic blood pressure reduction more than 20 or diastolic reduction more than 10 millimeters of mercury, and change from lying position to standing position. That's it. And profound hypertension means that this is related to medication-dependent problem. Anyway, a hemodynamic change may start from asymptomatic until the different kinds of shocks. But if the hemodynamic change, especially hypertension, is not treated, it can cause some multi-organ failure causes, and like kidneys, liver, and also especially cardiovascular system by decreasing venous pressure and venous return. But the question is here that what is the mechanism of hypertension happening during severe OHSS? I want to talk about this more importantly, because the most important phenomenon happen during OHSS is third spacing phenomenon. That is the most clue that to understand why happens here these clinical different symptoms around this disease. But when the ovary is uncontrolled, stimulated really well, really a lot, and is not uncontrolled, this causes to some pro-inflammatory and vasoactive mediators to be secreted a lot in the vascular circulation. And these pro-inflammatory factors are a lot, like TGF-alpha, TGF-beta, endothelin-1, one gland factor, prostaglandins, also prolactin, estrogen, histamine, and also VEGF, and so on. But the scholars have determined that the most important pro-inflammatory factors play important role in OHSS and is responsible for this third spacing phenomenon during this disease is VEGF. I'm gonna talk about this later. What is VEGF? VEGF, from
how would I get my access to you?
Yeah.
Nothing.
Excuse me.
Looking back.
Yes.
Yeah, can you just let us know the slide changes, because we are stuck up at one slide only.
Yes, go next. Another next. Next. One next. Yes, that's it. No. Yes. And I apologize, really. VEGF is a vascular endothelial growth factor. Until now, we start from a clinical presentation. OHSS, that's one of the important manifestations, but not really common, but is really important. In severe OHSS, that was hypotension. And now I want to go through the molecular and cellular mechanisms happening in this process, and that's VEGF. VEGF is a vascular endothelial growth factor. It has around 6 types and 3 types of VEGF receptors. Before explaining you about what does it do, I'm going to tell you something else to explain more to understand this concept. Between the endothelial cells, we have very tight connections. There's a really connections to make sure the body that any fluid is not allowed to come through the third space of the body. But in this disease, this connection is breakdown. And what caused the breaking down these tight connections is VEGF. So go through the next slide, please. Yes, look at this picture. This is into the cell, and these are the receptor of the VEGF. When VEGF plays on this receptor, and I'm going to tell you that the most important type of VEGF plays an important role in this phenomenon is VEGF-A. When VEGF-A places on this receptor, VEGFR, the VEGFR gets activated. And after getting activated this receptor, some intracellular signaling gets started. And this process is here. The activated VEGFR, gets signals to some protein tyrosine kinases, 2 kinds of protein kinases, tyrosine kinases to do something. These 2 kinds is SRC family and focal adhesion kinases. Take a look at SRC family. When SRC family gets activated by activating of VEGFR, SRC family start tyrosine phosphorylation of some adherens junctional proteins. These include V-cadherin, beta-catenin, etc. But the most important point is that the phosphorylation of adherens junctional proteins cause this tight connection to get breakdown and lose this tight connection, lose this barrier. Another mechanism happen to synergies to this process is activating FOC, focal adherent adjacent kinases, and this with by paxillin, both of them increase cell motility. I just want to tell you that this mechanism to understand that why cause ovary and this ovarian hyperstimulation syndrome to cause an effective vessels to get some difference and severe manifestations. That was it. So this is the cellular mechanism happening during the body. And excuse me, please go to the next slide. Yes, thank you. Until now, we understand that VEGF increases in the blood circulation by ovarian hyperstimulation, and then causes the vessels to increase the vascular permeability, and then allow the fluids to come to the interstitial space and cause such diseases, abdominal distension and others, hemodynamic changes, increasing the coagulopathy status, etc. All of them are really dangerous for patients. But how we can manage the hypotension? First of all, we have to hospitalize patients and then try to maintain the volume of the blood circulation for the body. We have two ways. The first way is intravenous isotonic fluid. It is really necessary because it can maintain also the blood pressure for the patient. But sometimes the problem is that most of the patients have hypoproteinemia and hypoalbuminemia. So they have to, maintain the protein for the body to maintain the body circulation. So we have infused the colloid in intravenously for the patients. Most of the colloid infusion therapy in treating hypoalbuminemia is real necessary, and these are like this: albumin, heterostage, mannitol, dextran, indoor fresh frozen plasma. But among them, according to scholars, the heterostage is much more used because of two reasons. Albumin is really well, but it is a human product, so it has really more allergic reactions for patients. But heterostage, it's not a human product, it's a synthetic product, and so it doesn't have really allergic reaction. This allergic reaction is really much less than albumin, as well as heterostage has a higher molecular weight from albumin, so it is optional to use them. Along with using intravenous isotonic fluid and colloid infusion, we have specially pay attention to monitoring of the patient. Daily monitoring, hourly, is really important to pay attention to them, to monitor them every minute later and hour to daily. These monitoring ways are body weights, fluid intake, abdominal girth, etc. And also we have to really pay attention to electrolytes, hematocrit, and liver enzymes, coagulation parameters. Why coagulation parameters? Because of lowering the volume of the blood, the coagulopathy stasis increases, and this is really are in danger for thrombotic problems and this. So this is all, and I wanted to tell you that really autism is a very dangerous situation. All of us in every field, we have to know about it. Thank you for your consideration.